Good morning, everyone. How's everybody doing this morning? It is day two of the Chronic Pain Solution with yours truly, Amy Eicher, your favorite chronic pain coach. And today we are going to be talking about the question, what's wrong with me and why am I still in pain? So the things that we will be talking about today will be answering that question. Do me a favor, when you join me, say hello, let me know where you are coming from. If you're watching on replay, please type replay and let us know. As always, tag a friend or share this link and let people know that this information is out there. We're trying to make sure that people get information they need to be able to help solve their chronic pain. 2024, we're not gonna suffer anymore. We're gonna get our lives back, right? A little low energy around here. It's like snaining. For those of you that don't live in the Midwest, snain is a mixture of ice and rain. It's deliriously fun. So what happens is it rains and then it freezes over and then it snows. So you've got like a nice sheet of ice everywhere that you're driving on. It's tons of fun. So if you have joined me, hello, do me a favor and in the comments let me know where you're coming in from and that you're here, because it's always nice to know who I'm chatting with on these things. And let me know what you're drinking. I've got a different mug today. Wishing I were at Disney World. I got to go in September and it was a phenomenal trip with my family. Very, very fun. Got to take my partner who I took him in 21 and that was really only his second trip to Disney. He'd been there for like half a day. And we took a nice long week vacation and totally turned him into a Disney-phile, which was pretty darn funny. McKinnon, am I saying that right? McKinnon is joining us from Nova Scotia. So many beautiful places in Canada that I would love to visit someday. But hello, and I'm sorry if I butchered your name. All right, well, by my clock, we're at 10 o'clock, and I want to be good to time because I know that you... Oh, hi, Pamela. I'm sorry. I'm very sorry about that. I should have just kept reading. I want to be good to time because I know that you're all busy and your time is precious. So let's get going. So as I said, my name is Amy Eicher. I am a chronic pain coach and a best-selling author, and I love to help motivated women get back to lives they love through education, discovery, and movement. Yep, that's what I do. Today we're talking about what's wrong with me and why am I still in pain. And I think those are very important questions to answer. Yesterday, we looked at why can nobody tell me what's wrong, and we looked a little bit of the system and the different types of pain that we have, and you can rewatch that on my YouTube channel or within the Facebook group and catch up on that. I would ask that you remember to put your questions in the chat because that is how you are going to win fun prizes. I would ask that you turn off any distractions. So I'm going to make sure my ringer's turned off so that nobody bugs me while we're chatting. Do the Facebooky things, like, comment, tag a friend, because Facebook will show this to more people in the group if we tell them that this is content that we want to see. And so many good questions were asked via email and in the group chat and in my private messages. Keep them coming. Friday is going to be amazing with all of these questions. So keep it up. All right. Oh, hi, Chris. She's listening from work. A lot of people are doing that. So if, don't worry about seeing me if you can like throw me in an earbud because I'm, unless you just want your whole office to hear. All right. So what is wrong with me and why am I still in pain? That is a great question. And we talked about 3 different types of pain yesterday. We talked about nociceptive, which is ouchy ouchy pain, like smash my finger with a hammer, or arthritis kinds of pain. We talked about neuropathic pain, which is pain that comes from your nerves, and is usually from a squishy injury or systemic issue like MS. Diabetic neuropathy would be an example of that. And then we talked about neuroplastic pain, that being pain that is driven by the nervous system and also the brain, that correlates very, very poorly with tissue damage, and it is what most of us in chronic pain that is the primary pain that we are experiencing. I had somebody say, Amy, why didn't you talk about psychogenic pain? There's a good reason for that. There is no proof that psychogenic pain exists. Psychogenic pain is pain from emotions, pain from mental and emotional trauma. Some would say it's pain that's made up. But the reason that I did not list psychogenic pain as a type of pain that we would be talking about is because pain isn't made up, pain is real. And so if you are wondering why I didn't list that, that is the reason. I do not believe science believes that pain is made up. Pain is always a very real experience. Pain can also come without tissue damage. We experience that all the time, and we take it for granted when we think about like heartbreak. Like think about the last breakup you had, or a breakup that one of your kids had, or losing a loved one, or losing one of our furry friends, one of our fur babies. Like that is a very, very real pain. I understand it doesn't feel like our chronic pain, but it is painful nonetheless. When we have headaches, we typically don't walk around thinking, ooh, I've got a brain tumor or I've got a lesion in my head that needs healing. We think, oh, I've got a headache. And we don't associate headaches with tissue damage like we do back pain or neck pain or shoulder pain or, private area pain. So those are just some things to think about, that, we can have very serious pain with very minimal tissue damage, or no tissue damage at all. But one of the things that I have learned coaching all of these years is that we can also get to a point where we start to ignore pain and we let things get out of control that we probably shouldn't. So because this is general information, I want to suggest that one of the things we can take off the table for why you're still in pain is nobody's actually found you haven't gone to the doctor, right? Like, so you're experiencing this chronic pain, but you haven't had a workup done. Okay. So if you're listening to me and you haven't seen doctors and you've been in pain for, a year or more, it's probably time to go see the doctor. And along with that, let's talk about red flags for when we should definitely see the doctor. Okay. So red flags are going to be if you do not have control over bathrooming, if you are losing your bladder or losing your bowels, or numbness in your saddle area. Saddle area is where you would touch where your legs and bottom would touch a horse. So if you are experiencing numbness in that area, and that's a new symptom that has not been checked out by a doctor yet, that's a very good reason to go to the ER. If you have passed out, if you have a fever or are vomiting, and that's new with your pain, that's a sign of infection, please go to the doctor. If you have had an accident, car accident, fell off the roof, I don't know, maybe tripped over your own feet in your basement and hit your noggin and then your shoulder hurt. Speaking from experience, If that doesn't go away in a reasonable amount of time, get that checked out. Okay. And then the last reason we're going to go to the ER is if we have a sudden loss of ability to move. So we can't, you can't pick up your mug anymore. Your feet, instead of being at a 90-degree angle, like here, this is your leg and this is your foot, your toes are dropping, and you find you have to like pick your leg up, or your toes are just kind of dangling. That we call that foot drop. If that is like something that suddenly came on and your doctors are unaware of that, losing power and sensation in body parts in our extremities is something we need to see our ER about. That is not a normal occurrence, shouldn't be happening, and we just want to make sure nothing emergent is happening. I will remind you that back pain, like, upper back, mid back, low back, into the buttocks, the likelihood that that's something dangerous is like infinitesimal. It's 1% of people with back pain. And remember, we said there's a lot of people that experience back pain. Like almost everybody in their lifetime experiences at least one bout of back pain. So the chances are it's nothing emergent, but losing your bowels, numbness in your saddle area, passing out, fever, vomiting, losing power or sensation to your limbs, and accidents and falling are all with new pains or intensifying symptoms. Those are good reasons to go to the ER, check in with your GP depending on your relationship with them. But those are things that we don't want to ignore. We don't want to ignore things. You all know, if you've been dealing with chronic pain for any amount of time, that the ER is not the place to go if you're experiencing pain without any of those things. The ER is for emergent issues, and while I understand you are saying the level of pain that I am experiencing is at an all-time high, I can't deal with it, I can't cope with it, but I need some help. And I strongly suggest that if your pain is so bad that you are in danger of harming yourself or taking illegal substances, that an ER visit is better. But I need you to tell them, I am here because I cannot control my pain on my own anymore. I understand that you're not going to be able to tell me what's happening, like if you don't already know, but I need help managing the pain. And you may or may not be seen. And I need you to understand that. The best place to get pain help is with your primary care. I encourage my clients to get a plan on writing with your primary care physician that you can bring to the emergency room with you in case your pain is at unmanageable levels. Okay? So that is some of the way that we're going to get our control back and our safety back when we're going into situations that we know are very challenging. When I first started experiencing long COVID, I was getting terrible headaches, and they lasted for months and months and months. And I didn't want to go to the ER because I knew there was nothing emergent about what was happening. Like, there wasn't an emergency that was putting my life at risk, but like, man, the headaches were out of this world, man. And so I finally went to my prompt care because I knew that there were medications that they could give me at prompt care that could probably help. And when I went in, I said, look, I've had a headache for a long time. I cannot manage this myself anymore, and I came here for your help. Would you please advise me on what some of the best things that I can do for this are? And then when they started asking, how long have you had the headache? And I said, like, 3 months, they were like, oh my God. And they got me, some very simple medications. They got me a mega dose of anti-inflammatories and a dose of Benadryl, and that worked. And then they told me that I should come back if it happened again. And so for several months, I went in after the headache wouldn't subside for 3 weeks or so. And they gave me the medicine, and after I think 3 or 4 sessions, I didn't need to go anymore, and that was very, very helpful, and I thanked them for helping me come in. So they put it in my chart that I was allowed to come in and nobody should give me a hard time about it, which I really appreciated, because I told them coming in and seeking help is hard for me based on my history. So I had to be vulnerable, and I was very thankful that I ended up with clinicians that were willing to listen and help, but I understand that's not always the case. So you know you and the providers that you're with best. So I'm going to suggest that as a means for communicating with providers in emergent situations, but I also trust you to use your best common sense and know whether or not being vulnerable at that level is going to be helpful or harmful to you. All right, so if we're looking at why am I still hurting, I think it's important that we go over a little bit of data looking at healing times. Okay, now in your workbook, I put three visuals that go through healing times and normal findings on MRIs, and I'm just going to rattle them off right now, but they are in that workbook for you to look at so that you can find your injury and take a look at whether or not you are still in pain outside of those normal healing times. Okay, you ready? All right, so I want you to have, this is really important that you have accurate information about this, okay? So tendinitis, which is inflammation of a tendon, takes 3 to 8 weeks to heal. It's stubborn, it's angry. Nobody likes having tendinitis because every time you move the joint, it hurts because the tendon is what connects the muscle to the bone. That's its job, that's what it does, and it's inflamed, and it's angry, and it takes, on average, 3 to 8 weeks to heal. Muscle soreness, like from that Weekend Warrior project you did, should go away in about 3 days. And you'd be less sore if you worked up to the things that you wanted to do instead of just doing them all at once. Muscle strain, so that can come from lifting things that are too heavy, falls, believe it or not, so like because you tense up when you fall, you can get muscle strains and ligament tears that way. But a grade 1 strain, which would be like, you know, your everyday sprained ankle or your sprained SI joint, that's going to take 1 to 2 weeks to heal. It's pretty simple. We grade muscle strains all the way up to grade 3. And a grade 3 is very, very, very rare, and it's a very severe strain. It would come from some kind of an accident, most likely. And that's going to take 6 months. A grade 2 is going to take 3 months. So the average muscle strain, you're really looking at 3 months to heal. And if you're still in pain after that, we've probably got some nociplastic pain at play. Ligament sprains are pretty much the same. They take a little bit longer. Ligaments connect bone to bone. Muscle makes bone move. And ligaments don't have as great of a blood supply, so they take a little bit longer to heal. It doesn't mean they don't heal. They just take longer. And a grade 1 sprain is 1 to 3 days. A grade 2 is about 6 months. A grade 3 is 9 months, and a grade 4 is that it's completely torn. You may be familiar, like if I had a friend that was a runner, and she was chronically spraining her ankle, and so she needed to have a surgery where they like shortened one of the ligaments in her ankle and then just kind of stapled it back to the bone and set her on her way. That would be like a grade 4, and that's just not gonna heal. It's not gonna heal. It's just, like, the surgery will heal, but like the original sprain that was causing her to roll her ankle and her ankle to be all floppy woppy, that wasn't going to heal. So she needed surgery to shore up that joint, and that's exactly what the surgery did. And then a broken bone takes roughly 3 months to heal. So, and that includes your spinal fractures, right? So if you had a vertebral fracture, you're looking at like 3 months for that puppy to heal. Not 3 years, not 10 years, not the rest of your life. Okay? So the longest healing time we really have in there is 9 months for a like horribly sprained ligament. And while that's no fun, none of these injuries take decades to heal, okay? And I want to remind you that pain is not inevitable just because we are aging. Just because we're getting older doesn't mean that we have to experience pain, and it doesn't mean that our bodies won't heal. All right, so if you are past these mile markers for these healings, I'm going to suggest to you that these things, strains, sprains, tendinitis, broken bones, are not why you are still in pain. The ribs that you broke playing field hockey in high school, now that you're 50, are not why you hurt, okay? I've mentioned before that chronic pain is a terrible indicator of tissue damage, and we have a lot of research to prove that that is true. And I am curious, for those of you listening now or on replay, is there anything that they're finding in your films to explain the severity of your pain? If it's yes, they're finding something and you would like to share with me what that is, I would love to know. If the answer is no, go ahead and just put no. No, they didn't find anything in my imaging. Okay. So while you are thinking through maybe what some of your imaging has shown you, I would like to share with you some facts that have completely blown out my gray matter over the years as I continue to share these numbers. I don't know how many times I've given presentations like this, and I will admit I really just kind of want to put my head in my hands at this point during our session and be like, wow, this is unbelievable, because it is. So here we go. This is a variety of different studies taken of people with absolutely no pain, okay? So the study parameters asked for people with no pain at all, and they put them through an MRI to see what they could find. And they found in a group of 1,200 people, give or take, they found 87% of these people with no pain at all had disc bulges of varying degrees. 87% of people. So when I say disc bulges, sorry, I'm going to sit on my foot. Everybody switch positions, get comfortable again. But yeah, so when I say disc bulges and arthritis are wrinkles on the inside, it's like gray hair wrinkles, like those things come when we age. So do disc changes and arthritic changes. Like, it is part of aging, and it can be there without causing pain. So I'm not saying you're a wimp if you have pain. That's not what I'm saying at all. But I am saying just because you have those things doesn't mean that you have to live with pain. It's a contributing factor. I'm sure that it is, because it's irritation to tissue. However, yesterday I said that's the 75% of other stuff. It is the 75% of other stuff that is making that arthritis be an issue. So if we address the other stuff, which we're going to talk more about tomorrow, we have a much better chance of living larger and being in less pain. So understand that I'm not saying it's not important at all. I'm just saying that there are people that have these things and also do not have pain. All right. Study with over 3,000 people found 37% of people in their 20s had degenerative disc disease, which is not a disease and is one of my least favorite terms in the medical community. And if you are in your 80s and we stick you through an MRI, 96% of us are going to have degenerative disc disease, which again is not a disease. Did you guys know that it was not a disease? Did you know degenerative disc disease is not a disease? There is no disease progression. It's literally aging. It's literally aging. It's so disgusting. I don't understand why we keep calling it this. Quick story. So I worked in a nursing home for a number of years down the way from me, and I had so many awesome clients. I had this 90-year-old woman that was just like, she was like the consummate grandma, just like she was thin and beautiful and wore the pearls and the pink sweaters and the whole nine. She was awesome. And I can remember seeing her as I would like walk patients down into the common areas and do different things. And she was an independent living, 90-something years old, and just the epitome of beauty and sophistication. And one day she comes in a wheelchair into the therapy room, and I'm like, Greta, what is going on? She'd seen the PT, she'd seen the doctor, she'd had some back pain for a while, and she starts crying, and she said, Amy, I'm dying of degenerative disc disease. And I was like, Greta, sweetie, you are not dying of degenerative disc disease. You've got some pain, and we're going to solve that, but like this is not something that's going to kill you. The doctor made her think it was like cancer, guys. It means our discs are aging. We have aging discs because we're aging people. She was 90-something years old, rolled in a wheelchair, didn't even so much as have a walker prior to her experience with back pain. Doctor scared her so bad she ends up in a wheelchair. After 8 weeks, we got her back up and walking, and she was back to wearing her pearls and pink sweaters and didn't have back pain after that. But she was afraid she was going to be in a wheelchair for the rest of her life because the doctor told her she had degenerative disc disease. I know you guys have experienced something like this where a doctor has told you it's the worst case of arthritis they've ever seen. You're bone on bone. Your arthritis is terrible. You've got the back of a 90-year-old. Well, if we all had Greta's back, we'd be walking on our own, doing whatever the heck we pleased, playing with our grandkids. So have the back of my 90-year-old friend Greta. There you go. All right. Shoulder abnormalities. This is a great one. It was a small study. There were only 50 people in it, but in this group of 50 people between the ages of 40 and 70, 96% of them had some kind of rotator cuff tear or an acromion hook, or they had a labral tear. They had some kind of shoulder issue if they were between 40 and 70. 96% of the people in that study had some kind of shoulder deformity, but no shoulder pain and no limitations. In the hips, we've got a study of over 2,000 people, and the shape of the ball and the socket is the cam and the pincher, and you can have changes in that ball and socket, which a lot of doctors are like, oh, that's got to be the reason for your pain. And what they found is that 34% of people had cam deformities and 67 had pincher deformities, and almost 70% had labral tears in their hip. So they had changes to the ball or the socket, or they had tears in the suction cup in their hip called the labrum. You have one in your shoulder too. They're like the little suction cups that hold the ball into the socket, and they can have tears in them. And just because you have a tear doesn't mean that it has to always cause pain. You can have those things and also not have pain, which I think is really important for all of us that don't want surgery, don't want more medical intervention. We need to understand that we can have these things in our body, and it is possible to not have pain with them. Last body part that we're going to look at is a study of over 5,000 folks over the age of 40, and they scanned everybody's knees, and what they found was that 43% of people had osteoarthritis in their knees, and another 43% had cartilage defects. So tears, calcification, but changes in their knee. So what I'm saying is that if we took you when you were healthy or when you weren't in pain and we put you through a scanner, the chances are very, very good that you have whatever you had then, whatever it is that they're blaming on your pain now. I know I've got 2 herniated discs in my neck, 2 in my back. I've got arthritis in my hips, my pubic symphysis, my neck, probably some other places that haven't been scanned, but I don't have pain in any of those places. I did, and I have had pain in those places, but once I solved some of my other issues, the way I related to my pain, the way that I related to the medical system, the way that I took care of myself, those pains went away. And they no longer irritate me. So that can be your story too. Now, I do not have autoimmune diseases. I am not dealing with rheumatoid arthritis. I am not dealing with diabetes. I am not dealing with cancer. I am not dealing with MS, right? So I'm not dealing with EDS. Those things can change what goes into your pain picture, but that doesn't mean that your life can't improve. I just want to be clear that we just don't know who's going to end up pain-free and who's not. But I wish we could. I do. I really wish we could. Do me a favor, if you have questions on anything I presented so far, go ahead and type that in. I'm going to take another sip of my coffee. Because I know I'm throwing a lot at you here, but I'm hoping what you're taking away so far is I can have these things on imaging and it doesn't mean I have to be in pain forever. Okay, well, you guys submit questions. I'm going to keep going. And I'm going to say that I want to remember, I want us all to remember that our providers really do desire to give us an answer. They want to be able to tell us why we are experiencing pain, and they want to be able to help us and fix us. But they're taught that what they see on the imaging is the reason for the pain. And if there's nothing in the imaging, then we shouldn't be in pain. And that's problematic for all of us, especially those of us that said there wasn't anything significant enough for our doctors to understand why we're in the pain that we're in. So, yeah. And then, you know, providers telling us there's nothing wrong with us and that it's in our head, like happened to me when I was a teenager and I was initially injured, has a really damaging effect on us, because now we're gaslighting ourselves, right? Am I really in pain? Am I just being a baby? Am I not sucking it up enough, right? Like, do me a favor, hit the like button if that's something. Have you heard any of those things in your own head? Like, are you telling yourself you're not being strong enough and that maybe this wouldn't hurt other people? Have you wondered if you're making it up? Because I promise you, you're not. I also promise you it's not your fault. You didn't do this to yourself. You don't want this. I know you don't want this. Nobody wants to be in pain all the time. It's exhausting. It's crushing. Right? It's crushing. Nobody wants to be in pain all the time. All right. So let's assume we've been to the doctor and they couldn't find anything, and now we've moved on to the manual forms of therapy. Now we're seeing the chiropractor, the physical therapist, the massage therapist, the DO. We're seeing the doctor of osteopathy, and they're moving our bones around or whatever. And so they have told us our alignment is off, our posture needs fixing, we're unstable, we have muscle imbalances. I think those are the main ones. Trigger points. We've got trigger points or scar tissue, or our fascia is off. Pamela, I'm going to address that in just a nanosecond. But do me a favor, give me a like, give me a yes, give me, let me know whether it's alignment or instability or muscle imbalance or trigger point or fascia that you have heard listed as the reason for your continued pain from, one of your manual medical professionals. I would like to politely and cautiously submit for your consideration that, one, if these things were true, what they're doing that they're saying is fixing it would have fixed it by now. You shouldn't have to be in therapy for the rest of your life to fix those things. I was told that the reason I was in pain is because my pelvis was out of alignment and unstable. We tried to correct that for 18 years with physical therapy and belts and tapes and all kinds of wonderful things, and it never worked. So then I had surgery because bolts in my pelvis. Here, look, I have a picture. This is the inside. Oh, that's upside down. That's the inside of my pelvis. 1, 2, 3, 4, 5 screws. Yep. 3 on my left, 2 on my right. There it is. That definitely stopped any instability, definitely stopped any alignment issues, but did not stop the pain. So then I was told, well, that's not it. It's muscle imbalances. And we have some problem. We have some problems with these stories. So our researchers are really, really important because they're the curious ones asking the questions like, well, okay, so all of these tests to determine instability, fascia, trigger points, muscle imbalances require the use of the clinician's hands. So researchers have studied how sensitive are human hands. Is there such thing as like an expert clinician that can feel things with their hands that a baby clinician can't? And what we found out is that nobody agrees on anything that they're feeling in somebody else ever. So any test that is done that requires a clinician's hands to determine is unreliable. It is unreliable and does not always come up with the same answer. And I would like, if you will indulge me in a quick story, my lips are dry. I would like to share with you an experiment that I did with my friend Anthony Lowe. Anthony is a physical therapist out of Australia, and we worked together on a bunch of different projects. And we would start his class out asking all of the attendants to test my pelvis for pelvic instability. Whatever test they used, they needed to test and assess me. And this is after my surgery. So I've got all of those screws in my SI joints, right? So we have done this with several hundred therapists. Several hundred therapists. All but one. And it was the one that came up with the right answer was somebody that doesn't do manual testing. And so she was like, I don't know. I can't tell. I don't think anything's moving. The other 299, 399 therapists all found that my pelvis was moving normally, or that my right side was hypermobile. Now, I had been told my entire life that my right side was hypermobile, and I gave them my symptoms as they were prior to surgery. So either everything was moving fine or things were too loose, but only one person found that nothing was moving. Guys, those bolts are like they're the size of like a Crayola pen, right? Like a marker. They're super thick. They're made out of titanium. I promise you, my pelvis is not moving anywhere. But these tests that we use are so inaccurate that even on somebody whose pelvis is bolted together, these clinicians were finding that my pelvis was moving. Is anybody else's mind blown by that? Because I was. I absolutely was. And in a different situation, I had a DO that I was a student for find the same thing. And when I said, but doctor, I've got screws in my pelvis. She absolutely lost her mind, decided my screws must have broken and I needed to emergently go to the hospital because something was wrong with my surgery. I will remind you, I was in no pain. I had had no accidents, but she couldn't deal with the fact what she found with her hands was inaccurate. So when we are in these situations where our providers are telling us that this is the reason for our pain, I am strongly suggesting to you that the tools that they are using to make that assessment are not strong enough to determine that that is true. And if we were truly unstable in our back, in our spine, in our pelvis, that absolutely 100% is an emergency. It can happen in car accidents. So trauma surgeons know how to put an unstable pelvis back together. And if you Google pelvic trauma, you will see what that surgery looks like. Use caution because those screws are really long. Yeah, those screws are really long. So you can have a medically unstable spine or pelvis, but that is an immediate surgery that needs to be taken care of immediately. Like you can't walk around on that. Okay? So I understand you may have been told that instability is your issue. I promise you it's not. Joints are intended to move. We need them to move. It's a description that they were taught in school that's inaccurate and hasn't been corrected. So one of the other things I hear is, oh, but Amy, I've got scoliosis, and that's why I'm in pain. You know who else has scoliosis? Two names that I hope you're going to recognize. One is Michael Phelps. You know, big arm span, Michael Phelps, fastest man in the water, faster than dolphins. Well, I mean, he's really not, but you know what I mean. I'm a swimmer. I idolize a little bit. Yeah, Michael Phelps has scoliosis. You know who else has scoliosis? Usain Bolt. Fastest man on land, or at least he used to be. Maybe somebody surpassed him. But both these dudes are super, super fast. One in land, one in water. And they've got scoliosis. And my understanding is that both of them manage with exercise and mindfulness and a variety of other things. So, so they have very significant imbalances, if you will, and they're not aligned properly, and they are elite fucking athletes, okay? This is good news for us. Like, this is good news for us, because if they can do that, so can we. And if you guys are like, yeah, but they've got all the money, and they've got all the access, and they've got all the, okay, you're right. So I will tell you that one of the little girls that used to play with my son also ended up with scoliosis and is a ballet, danced on point and had what would be considered a severe scoliosis, and danced and was on point and is married and living life. So don't let it be the boogeyman. Don't let these words be the boogeyman and make you think that just because you have them, you can't be well, okay? It's really important, because you can be well. All right. So why are you in pain then? Okay, we've heard me say the nervous system. We talked a little bit about it being the thing that's wrong, if you will, okay? I'm going to guess, dollars to donuts, if you are in this group and you've been in pain for over a year, you've been dismissed by your medical professionals, you've done everything that you possibly can, you are a people pleaser, you are a type A, maybe you've got a little bit of religious trauma in your background, maybe you had kind of a rough upbringing, and by rough I just mean maybe things were hard, or maybe mom and dad were very different types of parents. Maybe you were like me and you were sexually abused. We'll get into more of that tomorrow, but maybe you've got some other stuff that made life harder. Maybe you're neurospicy. Are you neurospicy? Because did you know that neurospicy, neurodivergent people are more likely to have chronic pain? Crazy, because their nervous systems are different. So Your pain is real. You are not making it up, and I always believe that your pain is exactly where you say it is, and it hurts exactly as much as you say it does. And all I'm telling you is all of that can be true, and it doesn't have to be tissue that didn't heal. Okay? If there are no red flags in your scans, if there are no tumors, if there is nothing in your blood work indicating that you are terribly sick, you have the ability to heal. You have the ability to heal. And what we've got to do is, now that we understand that doctors don't have all the information we need, and we have the information that we need if we've been through the scans and the stuff, right? So in your homework, there's going to be like what my doctor said, what my DO said, what my massage therapist said as the reasons for your pain. And I would really like you to list that out for your own sanity today. I would like you to really think through what you have been told are the causes for your pain. And then maybe consider if the treatments for those things have worked. Because if they're working, that's fantastic. Like, if you're getting out of pain, that's terrific, and you need to keep going in that direction, and then maybe add in some of the things we're going to talk about tomorrow and the next day. But if they're not working, I need you to really, really consider that the pain that you're experiencing is primary nociplastic pain. And that's not going to respond to the things that are traditionally offered through pain medicine. Pain medicine can help us. Massage can help us. But those explanations that I gave can also hurt us. They can cause us to hyperfixate on the way that we move, on what we're doing that's creating more damage, right? And if we think we're causing more damage, why are we going to try things? We're not. We're trying to get out of pain, not stay in it. But what difference does it make if the pain isn't coming because of damage? What if you're safe to move? What if you can have those things on your snapshots, on your imaging, but it doesn't mean that you have to be in pain for the rest of your life? What if you can have scoliosis and be the fastest, woman in the water or on land? I really should probably find some, well, I mean, my friend was a female, but I should probably find some female athletes with scoliosis. You are not crazy. You are not alone, and you are not out of answers. And I really want you to hear that today. Hopefully, I have given you some data to chew on today. And that I've shown you why it's really important that we rethink the reason for our pain. Because if I'm right, and it's not tissue damage, that means there are a whole lot more options that are open to you. That means we can start being creative again. We can start experimenting and exploring. Wouldn't you like to do that? Tell me in the comments, do you want to experiment? Do you want to explore? Do you want to get curious about what you might actually be able to do if this isn't a lifelong injury? I think it's time that we get our monster spray and we go under the bed and we spray out all of those monsters of instability and bone on bone and spines of 80-year-olds. We are adaptable and changeable, and we deserve more. And I want you to have more. I want you to have more. Tomorrow, we're addressing the nervous system. We're addressing the nervous system and how it all comes together, like how it works and how it keeps the pain going. I want to give the heads up that a lot of people talk about this as a learned behavior from a behavioral perspective, and I want you to know that while that's going to be a little bit of what I present tomorrow, that's not the totality of it. So there's so much more about chronic pain that is unconscious, and it's when we start to recognize what we're doing unconsciously, because it makes sense. And because the brain's job is to protect the meat sac, that's us, cute things, the meat sac. And yeah, so we gotta break that apart, and it's not fun. I mean, it is fun, and we're gonna talk about clowns and coffee and all kinds of things. And type your questions in now, cause I gotta give you homework. I want to know what you, after listening to today and doing your homework, and you're going to go through that, and you're going to look at all the stuff in the workbook. Your homework today is to tell me what do you think is the cause of your pain? What do you think the reason for your pain is? And there are no wrong answers. I'm just curious what you think after listening to today. Don't forget to open your email tonight, because there will be another task to earn points, and I drew the winner, and the winner from yesterday was Chris. Chris, thank you for sharing the link, and you will be receiving a copy of my memoir if you don't already have it. So do me a favor, send me your address. I know I have it someplace, but send me your address and I will get you a copy of my memoir. And if you have that one, we'll find something else for you. Just let me know. So yay, Chris. Okay, there was a question up here that I'm going to go. Okay, my family doctor told me my soft tissue damage and other injuries and pain would go away because of age. So Pam, I would say they will heal because of time, but that doesn't necessarily mean that the pain went away. And that is poopy. And hopefully maybe you've just got some healing time left. Unless you meant, and I read that wrong, and you meant that your doctor said you were just going to have pain because you were getting older. Like, my dad is 89. He's 89 years old, and he had his first round of, like, back pain 2 years ago. And my dad is a special kind of man. But we're talking on the phone, and he says, Amy, you can't imagine this kind of pain. And I'm like, do you not remember when I couldn't walk across campus when I was 18 until like I was almost 40? Did you? And he was like, no, this is so much worse than that. So may all of us have pain like my 89-year-old dad that, you know, he didn't, and it's gone now. But yeah, we don't get pain just because we age, and my dad is proof of that. All right. With my fibromyalgia, okay, so this is Georgie Dottie. I'm assuming we're talking with Dottie, but I correct me if I'm wrong. They say, with my fibromyalgia, a hug can be extremely painful. I believe something is making our pain alarm go off. You are 100% spot on. So I talked about that yesterday, where things that shouldn't be painful are painful. And we're going to talk about things that fill our cup tomorrow. But Dottie, you are absolutely correct. What happens is that when our cups are full, is going to be the illustration that we use, things that shouldn't be painful can be perceived by our nervous system and brain as painful. So absolutely 1000%, yes. It has to, like, I don't want to get too far ahead of myself because I'll keep talking for hours. Because the nervous system part is really where all the freedom is when we start to understand that. But 100%, yes, you should believe that there is something causing your nervous system to go off, and it's not damage. There's not enough room for other input is really the quickest answer that I can give for that. But come back tomorrow and keep asking questions about that, because we'll talk about it ad nauseum. Okay, hang on. Georgie is short for Georgiana is my real Dottie. Oh, sweet. Okay, thank you for correcting that. So should I call you Georgie? And your name is beautiful, by the way. And Pamela says she's experienced pain for over 6 years, and she thinks one day she's going to wake up without pain. She had a car accident over 6 years ago. Rebecca, if you're still on, can you tag Sandra for me? So Sandra can give her experience to Pamela if she wants. Either is fine. Okay, well, thank you. You can call me Amy or Hey You or that tall girl or Smiley or whatever. They called me the Smiley Tall Girl in the nursing home that I worked at. Is that Smiley Tall Girl in today? But yeah. Pamela, we don't know each other yet, so I hope that you will forgive me for using your comment as an example. I mean this in the spirit of I woke up like that for 20 years. Every morning I woke up hoping that the day was going to be different and like fighting for different. And I firmly believe the fact that we are waiting for something to, like we're waiting and hoping for something to change, but our behaviors stay the same. That is one of the really, really, really hard parts of being in pain, is that keeps us in pain. So I don't love the word acceptance because it feels like giving in, and that is not what I mean. I mean that I am living alongside the limitations. Like, I'm not fighting them or wishing them away. I'm merely acknowledging that this is what today brings. And man, that still sounds pretty ethereal and all of that. But like I said at the beginning, it's snaining outside, right? So here in the Midwest, if you're unfamiliar with snain, that is a nice rain-snow mixture. Terribly dangerous, freezes and thaws, and it's gross out there. So I can be angry at that. I can be pissed. I can have any emotion I want about that, right? But none of those emotions are going to change the fact that that's the weather today. So I can accept that now maybe it's going to take me longer to get to the store, or maybe I'm just going to wait. Like, I've got a grooming appointment for the Shih Tzu later today. Am I even going to leave the house? I'm going to wait and see what the weather's like in a couple hours. And maybe I'll go, maybe I won't. Where in a different part of my life, I would have fought that, and I would have been angry, and I wouldn't have wanted to change, but I also wouldn't want to be in the snow, and just all of this tension and anger and frustration and because it was snaining. It used to be like that with pain and just challenges for me, and I don't handle it that way anymore. Because I find that with the willingness to live alongside my fatigue, I get a lot more done, and I'm a lot happier, and I'm not in pain, which is kind of cool, because a lot of people with long COVID are in pain, and I am not, and I will take that. Yeah. Okay, so the other part of your question was something about the doctor. What from the perspective of your doc? No, oh, that was, sorry. Rebecca, that was you. That was a great question. Still reading Pamela's question, so hang on one second. Oh, Pamela, that sounds so familiar. Oh, God. I'm so sorry. So, yes, for many of us, we've got sensitivity to medicines, foods, and other things, which is also another really good indicator that your nervous system is on overload. It's a sensitive system. There's nothing wrong with that. It just means we've got less room for other input to come into the brain, which, again, I'll talk about tomorrow. Yeah, so Pamela, for you, I'm going to say we need to find other ways to manage your pain. And I did say one of the things that we'll talk about this week is like what alternative therapies are worth it and what aren't. And because your question or your comment kind of deals with that, I'm going to say this. almost 100% of the things that we do in physical therapy, because I am in that field. Like, I do still practice. I work for a nursing home down the way, a different one, but work for a nursing home down the way every once in a while. Everything we do as physical therapists for chronic pain, the story that we tell you about why we're doing it, whether it be cupping or Graston or trigger point massage or the series of exercises that we've given you for your shoulder, your back, your whatever, research has disproven the narrative, like the reason. That doesn't mean those things don't help. Okay, so those things can still help, but it's not for the reasons that are generally being explained to you. So I always say, if it feels good, if you have the money, like if you can afford it without going into debt, and you have the reserve of hope, right? Like, we have to have enough money, we have to have enough hope, and it needs to make us feel good. If you have those three things, then go ahead and try it. Go ahead and try it. There are very few things that are going to make things worse. Dry needling is something that comes with risks. Chiropractic care, especially to the neck, comes with risks. And anything where you're being injected with needles comes with inherent risks. But if it's just manual therapy, chances are, and you've just got musculoskeletal pain, give it a go. And if you don't like it, stop. And if it doesn't help, stop. And if it makes it hurt more, stop. We don't need to be doing any of those things, right? So the only thing that we know that helps chronic pain is movement that you enjoy. Not movement at all, movement that you enjoy and that you'll keep doing. So yeah. So as far as alternative therapies go, that is my caution and my encouragement to you is, if you have the time, if you have the money, and if you have the hope, give it a try. And if you don't have those things, don't worry. You don't have to do them to get better. They help some people some of the time. So why are you still in pain? You're still in pain most likely because your nervous system is pissed. It doesn't feel safe, it's angry, and it's stuck in a well-worn pattern that we need to get it out of. And we will talk about that tomorrow. You are not crazy, your pain is real, and that is the end of my session today. Go ahead and drop more questions, and we can answer them from here on out. Questions on what's wrong with me? Questions on any of those numbers that I rattled off? Questions on the physical therapy stuff? You guys are so smart. And Chris, you're going to send me a PM. Rebecca, would you just, I heard you congratulate, or I saw you congratulate her, but would you just type in that she's our winner? And I'll draw another one tomorrow, so don't forget to comment and do your homework. And whatever little special thing is in the email. All right, well, it looks like questions are all in for today. Thank you guys for joining me, and I will see you at 10 o'clock tomorrow. Oh, Rebecca, you are infinitely welcome. She says thank you for continuing to help us and give this information for free. And you are so very welcome. I wish that every doctor that had a chronic pain patient would hand out invitations to this so that we could all get freer sooner. So thank you. That touches my heart. All right. Bye, everybody. See you tomorrow. Clowns and coffee. Come. Oh, Chris says, wait, I have a question. Yes, ma'am. The delay on my end is awful. Also, if you don't want your questions, read out loud and you would prefer I answer them anonymously, please feel free to direct message me or shoot me an email at restoringvenus@gmail.com. I am happy to answer privately. Or at least not use your name, because we don't all want that, and I get it. Okay. Chris says, why do PTs give out dates for recovery healing when they don't really know? Okay, well, so first, most of the time when you go see a PT, they diagnose you. Well, they take the doctor's diagnosis that you come in with, and then they do their own assessment. And usually they're giving you recovery dates for healing based on the tissue injury healing list that I gave you. So most doctors will say, well, you'll be better in 6 months, because that's really the outside healing for any injury. One of my favorite sayings when I was in clinic all the time, because most PT places schedule you for 6 weeks at a time, I would always say, well, I'm just here to entertain you while your body heals itself. I am here for your entertainment. So because of the paradigm that we have in the medical world, which is pain equals acute injury, even when it's been going on for longer, because acute and chronic is a time frame. Acute means it's, in the first 3 months. Chronic is usually labeled 3 to 6 months. So if it's pain that's been around for 6 months or longer, almost everybody calls that chronic. But they're giving you the healing dates for what they think is a tissue injury. So they do think they know. They are giving you accurate information based on their assessment that they've been taught how to assess because of the problem with chronic pain education in schools. Yay. Yeah. One of the fun facts that I forgot to give yesterday was that I talked about pain management information that doctors go through, but I forgot to tell you that only 4 of the 104 schools in America, medical schools in America, make it required coursework to have any time in chronic pain. So there are 104 schools in the United States that a doctor can graduate from, and this does not include physical therapists, right? That's a completely different schooling system. But of the 104 medical schools, only 4 of them demand that you take any coursework in chronic pain at all. So you could go through medical school and get zero hours in chronic pain. Yeah. And the other thing that goes with that is the doctors that are usually less informed about pain are your primary care and your orthopedic surgeons. They learn surgery and techniques and all of those things, and they don't learn about pain, even though it's the #1 reason patients come to see them. Yeah. Okay. Chris asked about, why do PTs give a healing time if they don't know? And I said it's based on the way that they're taught. And then she said, well, I've been through 3 PTs now and I'm clearly not better, so I guess that would be nervous system nociplastic pain. And Chris, because you and I have been talking, like Chris and I have a relationship, we've been talking and working together, and I would say yes. Yes, there is a very, very, very good, high likelihood that it is very reasonable to assume that a portion of your pain picture is nociplastic pain. And you are starting to get a handle on that with Happy Bites that we'll talk about tomorrow. Happy Bites and nervous system stuffs tomorrow. Great questions. Keep them coming. Replay crew, don't be afraid to put your questions in, and I will continue to write them down. And if I don't answer them today, I will answer them on Friday. Thanks, guys. I'll see you tomorrow.